Why does grief cause fatigue in lung cancer families? When someone faces lung cancer, their family often feels a wave of intense emotions that can leave them physically drained. Grief is not just about sadness. It triggers a complex chain of emotional, mental, and physical responses that can wear a person out over time. Family members may start feeling exhausted even if they haven't done much physically because grief activates the body's stress response. This response releases hormones like cortisol, which in small amounts helps us cope, but when stress is ongoing, it can weaken the immune system, disturb sleep, and cause physical symptoms like muscle weakness and headaches. Caregiving for a loved one with lung cancer adds another layer of stress. Family members often take on many roles, from managing medical appointments to household chores, and sometimes dealing with family conflicts or disagreements about care. These added responsibilities can feel overwhelming, especially when the family is also trying to process the emotional pain of watching someone suffer. This role strain can lead to emotional exhaustion and physical fatigue, making it harder to find energy for daily tasks. The emotional toll of grief can also lead to mental health struggles like depression and anxiety. Watching a loved one go through illness and feeling uncertain about the future can cause persistent sadness and worry. These feelings drain emotional energy and can make even simple activities seem exhausting. When depression or anxiety set in, they often come with physical symptoms such as low energy, difficulty sleeping, and feelings of fatigue that persist even after rest. Sleep disruption is common among grieving families. Worry, sadness, and the demands of caregiving often interfere with restful sleep, which is essential for physical and emotional recovery. Without enough quality sleep, fatigue worsens, and cognitive functions like concentration and decision-making decline. Caregivers might also neglect their own health needs, skipping meals or ignoring their own rest, which only adds to their exhaustion. It's important for families to recognize these signs and seek support. Grief counseling and support groups can help family members process their feelings and reduce emotional burdens. Healthcare providers can assess symptoms of grief and fatigue regularly and suggest stress management techniques or respite care to give caregivers a break. Open communication within the family can also help reduce misunderstandings and emotional strain. In the end, understanding that grief causes fatigue through a mix of emotional distress, physical responses, and role pressures can help families seek the right help. Addressing these factors with support and care can make a big difference in helping families feel more resilient and better able to cope with the ongoing challenges of living with and beyond lung cancer. Remember, everyone experiences grief differently, so it's always best to consult healthcare professionals for personalized support and guidance.